The patient sustained a fracture of the right humerus during arm wrestling on March 26, 2024, and subsequently developed right radial lobe palsy. When he visited our clinic on May 16, 2024, he had complete paralysis in the right wrist and fingers, making it impossible to extend his hand. As seen in the imaging, the wrist is drooping down and does not lift at all despite exerting effort. Here is the patient's ultrasound image. A shadow of the surgical fixation device is visible in the right upper arm. Near the surgical site, the right radial lobe is significantly swollen. The muscles responsible for finger extension in the right forearm are atrophied compared to the left side. These findings suggest severe nerve damage. This is a video of the patient's treatment. This injection containing 5% dextrose, vitamin B12, and several other nutrients was administered around the swollen nerve. Along with the injection treatment, EST was performed and the patient was also taught how to conduct self-electrical stimulation therapy at home. The patient's muscle strength was reevaluated 2 months after the initial visit, and he was able to slightly lift the wrist while keeping the hand clenched. At the time this video was recorded, another patient of the same age had also suffered a humeral fracture and radial lobe palsy from arm wrestling and was undergoing treatment. One day, the two patients happened to meet in the waiting area. As I recall, today's patient seemed really motivated after seeing the other patient's progress. 3 weeks later, the patient showed further improvement in muscle strength. The wrist and fingers could extend slightly more. Here, we see another treatment session targeting the radial lobe injury site. The patient continued to perform self-EST consistently. 2 months later, functional muscle strength of grade 3 was restored in the wrist and fingers. Several months later, on February 14, 2025, the muscle strength in the wrist and fingers had improved to grade 4, meaning they could now resist external force. The muscle mass of the finger extensors in the forearm, which had previously shown atrophy, has also increased. In this video, you can see the wrist moving in response to electrical stimulation.